The Affordable Care Act does not just affect a particular group of people.
The Affordable Care Act is literally life-saving for my family.
I have several friends who have passed away because they couldn't get medical care.
Because not a lot of primary care physicians are going to be seeing patients that don't have health insurance.
Removing the Affordable Care Act or repealing it, as people are trying to do, would have a significant impact on the day-to-day lives of people that I treat.
Like, what do you mean pre-existing condition? What pre-existing condition does an elderly person not struggle with?
The reality is, when you have 9 autoimmune diseases, as my kids have, nobody wants to insure you.
If we give the Affordable Care Act a chance, then I think we could see things like infant mortality improve in places like Ohio and places across the nation.
Those who are not even here yet, those mothers who are dealing with, how do I get help for my unborn child? And then how do I take on the mentality that says health is important to me so I can continue to care for my unborn child and my child once they get here?
Today we have a government that's trying to really just make us extinct. And that's affecting 24+ million people.
A lot of the access to preventive care that people had, they may no longer have access to, and I think that that is going to bode poorly for long-term outcomes.
Having a primary care physician is the single greatest determinant in decreasing the cost of care and increasing good outcomes for patients. And that's what the ACA was able to do.
Without the Affordable Care Act, I would have continued to ignore things that were going on with my body.
If they don't have health insurance through their employer and they don't qualify for Medicaid, they are literally faced with a decision of, can I afford rent, can I afford food, or can I only afford my medication? We're not talking about small amounts, and we're not talking about things that are optional.
I've seen many people, elderly people, and people with certain physical disabilities who really couldn't get put in a decent skilled nursing facility, such as a rehab, because they had no insurance.
If the ACA was rolled back, those folks would not have access to continual care for their chronic condition, so they wouldn't have access to a primary care physician.
So if I had one message to give to Senator Portman, it would essentially be to hold off on repealing the Affordable Care Act without an adequate replacement that would allow me to do my job as a physician.
If you do not know someone who is affected by the potential of loss of the Affordable Care Act, you are detached from American society. I question your ability to be American.
The question is not whether or not the community has to pay the bill. They do. The question is, how do we keep the cost of that bill down? And that's where the ACA is so important.
The members of Congress should recognize what their duty is. That's to serve and protect the people. That's why they were voted in. Not to be so self-serving, just look out for the rich.
To steal someone's health care, who faces these dreadful health problems, is so unbelievably devastating that I don't know how you could ever look a constituent in the eye again.
So they need to just quit being so coward and meet their constituent, because they wouldn't be there if it wasn't for their constituent.
So Republicans have a great plan, you have a great plan. Could you please come down and share with me in my community what the plan looks like and how this will benefit me? You've given me a long list of what's going to be taken away and what's going to be thrown out, but could you help me understand what's going to work? Help me understand it. That's all I want to know.